CTS. Carpal tunnel syndrome, CTS, is a common condition that affects the wrist and hand. It is caused by compression of the median nerve, which runs from the forearm to the hand, as it passes through a narrow passageway called the carpal tunnel. The carpal tunnel is a narrow canal or tube in the wrist, similarly to a tunnel you could travel through by car. This part of the wrist allows the median nerve and tendons to connect the hand and forearm. The parts of this tunnel include carpal bones. These bones make up the bottom and sides of the tunnel. They are formed in a semicircle. Ligament, the top of the tunnel. The ligament is a strong tissue that holds the tunnel together. Inside the tunnel are the median nerve and tendons. Median nerve. This nerve provides feeling to most of the fingers in the hand, except the little finger. It also adds strength to the base of the thumb and index finger. Tendons, rope-like structures. Tendons connect muscles in the forearm to the bones in the hand. They allow the fingers and thumb to bend. The median nerve is responsible for providing sensation and movement to the thumb and first three fingers. And compression of the nerve can result in a range of symptoms, including numbness, tingling, and weakness in the hand and wrist. The small finger, the pinky, is typically not affected. Carpal tunnel syndrome was first described in the mid-1800s. The first surgery for the release of the carpal tunnel was done in the 1930s. It is a condition that has been well recognized by orthopedic surgeons for over 40 years. Anatomy and physiology of median nerve and its pathological conditions. The median nerve is a major nerve in the arm and hand that is responsible for providing sensation and movement to the thumb and first three fingers, thumb, index, middle, and half of the ring finger. It originates in the cervical spinal cord and travels down the arm through the brachial plexus, eventually entering the forearm and wrist. The median nerve travels through the carpal tunnel, which is a narrow passageway in the wrist made up of bones and ligaments. One of the most common pathological conditions affecting the median nerve is carpal tunnel syndrome, CTS, which is caused by compression of the median nerve as it passes through the carpal tunnel. This compression can be due to various factors, including repetitive hand and wrist movements, arthritis, pregnancy, and conditions that increase fluid accumulation in the wrist, such as diabetes and thyroid disorders. Nerve damage. In severe cases, if left untreated, CTS can lead to permanent damage to the median nerve, causing weakness and atrophy in the hand and wrist. Another condition that can affect the median nerve is median nerve entrapment, which occurs when the nerve is compressed at other points along its pathway, such as in the forearm. Median nerve entrapment can cause similar symptoms to CTS, but the location of the symptoms may be different. In conclusion, the median nerve is a major nerve in the arm and hand that is responsible for providing sensation and movement to the thumb and first three fingers. Compression of the median nerve, such as in carpal tunnel syndrome or median nerve entrapment, can result in a range of symptoms, including numbness, tingling, and weakness in the hand and wrist. It is important to seek medical attention if you are experiencing any symptoms of median nerve compression to prevent long-term complications. CTS is most commonly seen in individuals who perform repetitive hand and wrist movements, such as typing, assembly line work, or playing musical instruments. Symptoms of carpal tunnel syndrome. Compression of the nerve can result in the following symptoms. 1. Numbness and tingling. This is the most common symptom of CTS and is characterized by a burning, prickling, or tingling sensation in the fingers, especially the thumb, index, middle, and half of the ring finger. This sensation is often described as feeling like an electric shock. 2. Pain. Pain in the wrist, hand, and forearm may be felt, especially at night, or when performing activities that put pressure on the wrist, such as typing or using tools. 3. Weakness. CTS can also cause weakness in the hand and wrist, making it difficult to grip objects or perform fine motor tasks. 4. Swelling. In some cases, swelling may occur in the wrist and hand, causing a sensation of fullness or tightness. Reduced dexterity. Individuals with CTS may have difficulty performing fine motor tasks. such as buttoning clothes or tying shoelaces, due to a loss of dexterity in the affected hand. 5. Loss of coordination. CTS can also cause a loss of coordination and dexterity in the affected hand, making it difficult to perform everyday tasks. 6. Muscle atrophy. In severe cases, CTS can cause muscle atrophy in the hand and wrist, resulting in a visibly smaller and weaker muscle mass. It is important to note that not all individuals with CTS will experience all of these symptoms, and the severity of symptoms can vary from person to person. If you are experiencing any of these symptoms, it is important to seek medical attention to diagnose and treat the condition as soon as possible to prevent long-term complications. Possible causes of carpal tunnel syndrome. Carpal tunnel syndrome, CTS, is a condition characterized by compression of the median nerve as it passes through the carpal tunnel in the wrist. Carpal tunnel syndrome is caused when the space, the carpal tunnel, in the wrist narrows. This presses down on the median nerve and tendons, located inside the carpal tunnel, makes them swell, which cuts off sensation in the fingers and hand. Causes. The exact cause of CTS is not always clear, but a number of factors can contribute to the development of the condition. These include 1. Repetitive hand and wrist movements. Repetitive movements, such as typing or using tools, can put pressure on the median nerve and lead to the development of CTS. 2. Medical conditions. Certain medical conditions, such as arthritis, diabetes, and thyroid disorders, can increase fluid accumulation in the wrist and contribute to the development of CTS. 3. Pregnancy. During pregnancy, fluid retention can put pressure on the median nerve and result in CTS. 4. Fractures. Fractures of the wrist or bones in the hand can compress the median nerve and lead to the development of CTS. 5. Tumors. Tumors in the wrist or hand can also compress the median nerve and cause CTS. 6. Congenital factors. Some individuals may have a naturally smaller carpal tunnel, which can increase the risk of CTS. It is important to note that CTS is not always caused by a single factor, and multiple factors may contribute to the development of the condition. 7. Hormonal changes. Hormonal changes, such as those that occur during menopause, can result in fluid retention and increase the risk of CTS. 8. Obesity. Being overweight or obese can increase the risk of CTS, as excess weight can put additional pressure on the wrist and hand. 9. Amyloidosis. Amyloidosis is a condition in which abnormal protein deposits build up in various tissues in the body, including the nerves. This can lead to nerve compression and result in CTS. 10. Paget's disease. Paget's disease is a condition in which the bones in the body grow abnormally, leading to increased pressure on the nerves and increasing the risk of CTS. 11. Renal failure. Renal failure can lead to fluid accumulation in the body and increase the risk of CTS. Alcoholism. Alcoholism can result in dehydration, which can increase the risk of CTS by causing fluid retention in the wrist. 12. Other medical conditions. Other medical conditions, such as rheumatoid arthritis and lupus, can also increase the risk of CTS. It is important to note that the presence of any of these factors does not necessarily mean that an individual will develop CTS. However, these factors may increase the risk of the condition and should be considered when evaluating the cause of CTS. Diagnosis of CTS is typically based on a combination of medical history, physical examination, and nerve conduction studies. 1. The doctor will ask about the symptoms, such as tingling or numbness in the hand, as well as their duration and severity. During the physical examination, the doctor may check for weakness or muscle atrophy in the hand and wrist, and perform a test called tinel'ssign, which involves tapping the wrist to see if it causes tingling or an electric shock-like sensation. Nerve conduction studies can help determine if there is nerve damage and the extent of it. 2. Wrist flexion test, or Phelan test. In this test, the patient rests his or her elbows on a table and allows the wrist to fall forward freely. Individuals with carpal tunnel syndrome will experience numbness and tingling in the fingers within 60 seconds. The more quickly symptoms appear, the more severe the carpal tunnel syndrome. Imaging plays an important role in the diagnosis of carpal tunnel syndrome, CTS. Imaging tests can provide valuable information about the anatomy and function of the median nerve and surrounding structures, helping to confirm the presence of CTS and rule out other conditions that may cause similar symptoms. The following imaging tests are commonly used in the diagnosis of CTS. 3. X-ray. X-rays can be used to visualize the bones of the wrist and hand and to identify any fractures or other abnormalities that may contribute to the development of CTS. 4. Magnetic resonance imaging, MRI. MRI uses magnetic fields and radio waves to produce detailed images of the soft tissues of the wrist and hand, including the median nerve. This test can help to identify any swelling, inflammation, or other changes in the median nerve that may contribute to CTS. 5. Ultrasound. Ultrasound uses high-frequency sound waves to produce images of the soft tissues of the wrist and hand. This test can be used to assess the size and shape of the carpal tunnel and to identify any swelling or other changes in the median nerve that may contribute to CTS. 6. Nerve conduction studies. Nerve conduction studies use electrical stimulation to assess the function of the median nerve. This test can help to determine if the median nerve is being compressed in the carpal tunnel and to assess the extent of nerve damage. 7. Electromyogram, EMG. An EMG measures the electrical activity in muscles. EMG results can show whether you have any nerve or muscle damage. Imaging tests can be used in combination with a thorough medical evaluation and a review of the patient's symptoms and history to confirm the diagnosis of CTS. Initial treatment for CTS typically involves non-surgical methods, such as rest, splinting, and anti-inflammatory medication. 1. Wearing a wrist splint at night can help alleviate symptoms by keeping the wrist in a neutral position and reducing pressure on the median nerve. 2. Anti-inflammatory medication, such as ibuprofen, can help reduce swelling in the wrist and relieve symptoms. 3. Steroid injections. Steroid injections can be used to reduce inflammation and swelling in the wrist, which can help to relieve pressure on the median nerve and reduce symptoms of CTS. The most commonly used steroid is cortisone, which can be delivered directly into the carpal tunnel to provide rapid and effective relief of symptoms. Steroid injections are generally safe, but they may not provide a permanent solution and symptoms may return after several months. 4. Diuretics. Diuretics are medications that increase the production of urine, which can help to reduce fluid retention and swelling in the wrist. This can help to relieve pressure on the median nerve and reduce symptoms of CTS. Diuretics can be taken orally or intravenously and can be an effective alternative to steroid injections for some patients. However, diuretics can have side effects, and it is important to discuss the potential risks and benefits with a healthcare provider before starting treatment. 5. Other treatments focus on ways to change your environment to decrease symptoms. This is often seen in the workplace, where you can make modifications to help with carpal tunnel. These changes might include raising or lowering your chair, moving your computer keyboard, changing your hand or wrist position while doing activities. 6. If non-surgical methods are not effective, the doctor may recommend surgery to release the pressure on the median nerve. The surgical procedure, called carpal tunnel release, involves cutting the transverse carpal ligament to create more space for the median nerve. Surgery is usually performed on an outpatient basis using local anesthesia, and patients can typically return to work within a few days to a week after the procedure. In some cases, surgical intervention may be required to permanently relieve symptoms and prevent nerve damage. The following are some of the surgical options for CTS. A. Median nerve decompression, carpal tunnel release. This is the most common surgical procedure for CTS. It involves division of the transverse carpal ligament, which is the main structure responsible for compressing the median nerve. This procedure can relieve pressure on the median nerve and provide long-lasting relief of symptoms. Median nerve decompression can be performed using an open surgical technique or a minimally invasive endoscopic technique, depending on the preference of the surgeon and the specific needs of the patient. B. Division of the transverse carpal ligament. This procedure involves division of the transverse carpal ligament without division of any other surrounding structures. This procedure can provide effective relief of symptoms in some patients, but it may not be as effective as median nerve decompression in providing long-lasting relief. C. Partial wrist fusion. This procedure involves fusing the bones of the wrist to reduce the mobility of the wrist and relieve pressure on the median nerve. This procedure is typically only recommended for patients with severe CTS and other conditions affecting the wrist, such as arthritis. D. Nerve grafting or nerve transfer. In some cases, the median nerve may be severely damaged by CTS and may require reconstruction. Nerve grafting or nerve transfer involves transferring a healthy nerve from another part of the body to the damaged median nerve to restore function. Surgical options for CTS should be individualized based on the specific needs of the patient, the severity of symptoms, and the presence of any underlying conditions. Surgery for carpal tunnel syndrome has a very high success rate of over 90%. Surgery to repair carpal tunnel syndrome does not have a particularly long recovery. The bandage that covers the stitches after surgery can be removed in a few days. The hand can then be used for light activities. Making a fist is encouraged. Full range of finger motion and early symptom relief is usually seen within 2 weeks after the stitches have been removed. You can usually return to most activities by 6 weeks. Complications of carpal tunnel syndrome. Although complications are possible with any surgery, your doctor and surgical team will take steps to minimize the risks. The most common complications of carpal tunnel release surgery include bleeding, infection, wound healing issues, nerve aggravation or injury. In addition to surgery, physical therapy may be recommended to help improve strength and flexibility in the wrist and hand. The therapist may also provide exercises to help relieve symptoms and prevent future injury. It is important to seek treatment for CTS as soon as possible to prevent nerve damage and long-term complications. If left untreated, CTS can lead to permanent damage to the median nerve, causing weakness and atrophy in the hand and wrist. To prevent CTS, it is important to practice good ergonomic habits, such as taking frequent breaks and alternating tasks to avoid repetitive movements. Wrist splints and ergonomic keyboards can also help prevent symptoms. Additionally, maintaining a healthy lifestyle, including regular exercise and a balanced diet, can help reduce the risk of developing CTS. In conclusion, carpal tunnel syndrome is a common condition that affects the wrist and hand, and is caused by compression of the median nerve. Treatment options range from non-surgical methods, such as rest, splinting, and anti-inflammatory medication, to surgical procedures, such as carpal tunnel release. It is important to seek treatment for CTS as soon as possible to prevent nerve damage and long-term complications, and to practice good ergonomic habits to prevent future injury.